We're with Dr. Brandon Beebout at the Hilltop Pet Clinic, and we are talking about pain management, specifically after a surgery. Good morning, doctor. Okay, who's the star of the show today?
Star of the show today is Callie. She comes from Ellesmere, Nebraska. She tore an ACL back in March, April area, and been hobbling around. She's a working dog. She does an incredible job for the family with the cattle, and she loves it. So she's quite the inspiration. And we know that, as we've talked before with our ACLs, that instability is what we really want to fix. And going along with that, we create a lot of pain, even more than what the ACL feels like. These guys limp. It is uncomfortable, but they limp because of the instability. And so once we get that stable, we know in that acute post-operative period, we want to manage any pain. Back around the time I was born and those type of things, we have these nonverbal communicators where maybe we have more drugs to use, and we've gotten a little bit more innovative, and that's kind of what we're going to talk about.
Okay, so talk a little about the innovation that is relatively new.
So specifically, Nocita is a local anesthetic, just like your Novocaine that your dentist would use, and it's a kind of a gel form, and it's going to kind of release slowly but surely over the course of about 2 to 3 days. And you essentially infuse it in each layer as we close, and then they have that local anesthetic there for, again, 72 hours. And so these guys might walk immediately after, which is what we like to encourage.
Okay.
And so not feeling that leg is key. Somebody cuts into my leg and cuts into my bone, I sure as heck want some pain meds. And so we do also have fentanyl patch on this kiddo. That lasts about 3 days as well, and then we'll be on some anti-inflammatories, which we've talked in the past, kind of doggy ibuprofen, and then gabapentin, which is a neuropathic pain inhibitor, kind of like our Lyrica for fibromyalgia.
Okay.
And even the drugs that we use for inducing anesthesia have analgesic or pain properties.
Okay, so this is just basically for the surgery, and then there's other ways to manage the pain after it.
The immediate post-operative period is where we use our opioids as well as our local anesthetics. Best anesthesia, best pain medication is the local anesthetic. And then long-term, over the course of the next 2 to 4 weeks, she'll be on some anti-inflammatories on that gabapentin, and kind of working our way off of it as we kind of recoup.
Now, are there any side effects to any of the pain management?
So with opioids, as we see commercials for OIC, these can definitely slow down the GI tract. We may see some decreased appetite and that kind of thing. But overall, we see pretty limited side effects. And so it's something that's fairly safe to use. And we love that these guys are just recovering so much faster, getting them out of pain as, our furry friends are our best friends, and we hate to see them in pain.
So when she goes back, how long of a recovery will she have here? And then to go back, will she be on anything when she goes home?
Yep, so she'll be on the anti-inflammatories and the gabapentin really for 2 weeks till we get the staples out. And then we'll be encouraging walks, and she'll get longer and longer walks. At the end of those walks, she will be sore, and so they'll kind of use it intermittently as necessary. And then, 6 to 8 weeks. And really, with a dog of this size, 40 pounds or so, young kid, really tough dog, being a working dog, she'll be pretty sound in as little as a month.
So she'll be ready to roll then.
She will. Back to work.
Back to work on the farm. So if somebody wants more information on, pain management, or how you can kind of help your dog bring back the dog's life, quality of life, just give you a call.
Give us a call, schedule an appointment, and we'll talk about all the options because there are many out there.
Wonderful. Well, thank you for your time. I appreciate it. And Callie, good to see you. Stay with us because next week we're coming back with more Pet Doc.